Thanks, Melissa. My name's Scott Cordis. I'm the co-chair of the London Middlesex Primary Care Alliance, and my full-time day job, I'm the executive director of the London Intercommunity Health Centre, and also joined tonight by Vineet Nair, who's got clinic tonight, so he'll be in and out, but is also the co-chair of the LMPCA. So just a quick introduction to the LMPCA before we get into the presentation this evening. We're an inclusive network of primary care providers leading with a unified voice to improve the health of our community. And we are trying to lead systems change, drive health equity and continuous quality improvement, advance patient-centered equitable care in partnership with those who we serve, and improve the integration of primary health services with public health and other social care partners. And we try to speak with one voice and represent the interests of the primary care community. And events like this tonight, providing some education and connection to resources that you can use immediately in your practices as part of the work that we do. If you're interested in getting involved with us a little bit more, there are lots of opportunities if you're interested in leadership. LMPCA, we have an executive council that is comprised of providers in lots of different payment models as well as administrators, and we're always looking for people that are willing to and interested in providing some leadership. So if that is of interest, reach out to Melissa and she can get us in touch. So that's enough of the sales pitch for LMPCA, and we can get into the meat of the meeting. And I'm happy to introduce our we're going to go over learning objectives. Do you want to do that, Melissa, or do you want me to do that?
I can do that in the next couple of slides.
Perfect.
So our objectives for tonight are to learn about this community navigation team, as well as the physician hotline, and there'll be lots of information about that. And then really the meat of it is how you and or someone you're supporting so your patients can get help to find health and social services in London Middlesex. Like I mentioned before, we are MainPro accredited, so it's credit for up to 1 credit per hour. So our program, our LMPCA program, does receive in-kind financial support from Thames Valley Family Health Team, as well as the Middlesex London OHT. That's regards to administrative and logistical support for our program, but we have no potential conflicts of interest to report. I'll just hand over to our two speakers for tonight, just so they can verbally do their declaration of disclosures.
Hi, my name is Trudy DeVries, and I apologize. I have not had to do this before, but I do not have a conflict of interest in any of these. I am a member of the MLOHT navigation or MLOHT, and am not getting any funding through any other means, just as an employee. I hope that was okay, Melissa.
Great, thanks, Trudy. And Jenna?
Hi, everyone. Jenna Prouse, Manager of Program Development with Home and Community Care Support Services Southwest. And I have no conflict of interest to declare with this group and no financial support other than an employee of Home and Community Care Support Services Southwest.
Thank you. And now that brings us to Trudy's slide. So take it away, Trudy, and just let me know when you want me to advance the slides.
Thanks, Melissa. And good evening, everybody. My name is Trudy DeVries, and I am the Healthcare Navigation Planning Lead with the Middlesex London Ontario Health Team. And I just thank you for letting me join you this evening at this town hall. I'm here to talk to you a little bit about what we have been doing in terms of the navigation work with the Middlesex London OHT. So next slide, please. You are all aware that there are many different options available to us to find services. There's lots of really good opportunities for both you as primary care and as well as our community to find help. However, each one of these agencies has a different phone number, has a different website, and they each kind of look at very specific needs. So you may have to go to more than one in order to help one patient. So this is not only time consuming for you as primary care providers, but also can be a deterrent for our patients to get the help they need if they have to look for many different, look at many different directories. Next slide, please. So the OHTs were tasked to develop a navigation model. We were essentially asked to see if we could make navigation easier for our attributed population. So this navigation model was to be a 24/7, needed to be available 24/7. It was to align with the Health 811 platform, the provincial platform. We were supposed to make sure that we were looking at populations that were experiencing barriers and how we could help help them navigate the health and social landscape. And then also really look at those warm transfers. How can we support seamless transitions where patients didn't have to tell their stories over and over again? Next slide, please. So the MLOHT decided to look at kind of responded to this task with two separate streams. One of them was to create a Middlesex London Navigators collaborative. And this was really just an opportunity for any individual who considered themselves a navigator to get to know one another. So we currently have about 50 different 50 different people or agencies that are part of the collaborative. And we get together every other month and we just try to understand what are the services within Middlesex London area, how do we access them, and really be able to support our patients and clients better. LMPCA is represented at this collaborative. Melissa does join every other month to bring back any information for you. The other stream was to develop a front door approach. So really to try to find that one place where people can go to find the support they need. So we spent a lot of time with interviewing different agencies, doing co-design sessions, talking to other OHTs to see what they were doing, talking to OH West, really try to figure out how best to move forward. And we ended up approaching Home and Community Care Support Services to be our lead agency in this front door work. And just to be clear from the outside, they were really great in recognizing that they are good at navigating services that have to do with home and community care, but services that were beyond that more social in nature, that was a gap for them. And they were very transparent in letting us know that from the outset. So next slide, please. So to go a little further into this front door approach, we did meet with a couple of you in a co-design session back, I want to say in May, to really understand what would help primary care in terms of navigation. And we heard loud and clear that you want one place to go, one number to go to, not 4 different places to call for one patient, just one number that you could call and then be able to ask for help. So that's what we did. So working with home and community care, we kind of created, and I use the term created loosely a little bit, but we created 2 phone lines. So the first phone line that I'll talk about is the physician hotline. So this was actually relaunched just this month. It's been with home and community care for several years now, but it wasn't really, it was a bit underutilized. And so they're working at kind of relaunching that. And that is specifically for physicians. The new number that was created, which I'll also go into a little bit more detail, is the community navigation line. And that is for the public. It's for community navigators or providers. Pretty much anybody can call the community navigation line, but the physician hotline is for primary care only. Next slide, please. So a little bit more about this physician hotline. So first of all, I do want to recognize that the term physician hotline is a bit of a misnomer. So it isn't, not only is it not just for physicians, it would be for NPs as well. But it is for anybody on your team. So some of you may have MOA, some of you may have a reception or a nurse, or may have social workers, whoever. Anyone on your primary care team can call this line. So we have asked Home and Community Care if they would consider changing the name to Primary Care Hotline, just because it's a little bit more representative of what the hotline is actually hoping to provide. So this hotline is being, it's a dedicated line for you. It is being manned by care coordinators who are regulated health professionals. So the upside to that is that you can call this line and have clinical questions, right, for patients, but you can also call this line for social services. Now, that third bullet says that it's for patients currently open with home and community care support services. That is true, but I did find out last week, and maybe Jenna will be able to touch on this a bit more, but this number, if you called for somebody that wasn't open with home and community care, they would still help you out. So wanted to just clarify that piece. This hotline, this primary care hotline, is available 8 to 8, 7 days a week, 8 to 8. And they currently have services in French and English. So next slide, please. So this is, I tried to do this presentation with the London Family Health team, and there was a lot of questions around why would I use this number? When would I call this number? So I just came up with these simple little examples of when you might consider using this hotline number. So, and forgive me if this is way out in left field, if nothing like this ever happened in your practice, but perhaps you become aware of somebody who's couch surfing during a visit, or you have an elderly patient whom you realize is now really not able to get anywhere and needs help with transportation, or a single mom who's struggling with finances and can't get food for her kids, or perhaps it's an Indigenous patient who feels they may be bisexual and they don't know who to talk to. So these are just some of those things that kind of come up that you're thinking, okay, they need a little bit more support than I can give them in this moment. So what you could do in that instance, in any one of these instances, would be to call the primary care hotline. Now, I say call the primary care hotline basically means whatever the process is in your office. So if that means you want to call that hotline with a patient sitting beside you, that's fine. If you call that hotline as the primary care provider after the patient leaves, that's fine. If you hand this over to your receptionist, your nurse, a social worker on your team, whatever, and they call, that's fine. The point is that someone can call this hotline and then give the person, the care coordinator that's on the line, you give them the patient's information, what they're asking for, and then that care coordinator will kind of go with it and get the help they need. That last bullet is about kind of that loop back process. How do you find out whether or not this was done? So as I mentioned, the co-design process that happened back in May, it really was interesting because it was almost 50-50. Half the docs said, I really do want to hear back as to what's happening with my patient. The other half said, I'm not really sure, I need to. I trust them. I know that they're going to get the help they need. So that process of looping you back to you is still something we're trying to figure out. We're very cognizant of the fact that we don't want to add to your workload. We don't want to add to the care coordinator's workload, but we also have to ensure that we're keeping the privacy of the patient. So for the time being, if you're calling and you really want to know what's going on, just ask the care coordinator to let you know how this turns out. Next slide, please. So also just want to briefly go over the community navigating team. So this one has been going on since July 11th. They are open Monday to Friday, 8:30 to 4:30 or 8 to 4. It's basically during the day. I say they're Middlesex, London only at this time because, as some of you may be wondering, Home and Community Care is a Southwest-wide agency, but for the purpose of this community navigation team, it's for Middlesex, London only. The people answering the calls here are primary care, patient care assistants. So they are not regulated health professionals. So they can't support in clinical questions, but definitely available there for any kind of trying to find social services. And we, as I mentioned before, they recognized that they needed a little bit of help with those social service information. So I've been spending time introducing them to some of the connections through the Middlesex London Navigators Collaborative, as I mentioned earlier. And we've been working with Home and Community Care, and they now are also working with voice on-demand interpretation services so that people can call and communicate in whichever language they're most comfortable in. So next slide. These are the numbers for you to call And that's it for my presentation. And I wonder if maybe, Melissa, I don't know if we want to do questions all at once. Happy to do whatever works best for you, but happy for questions whenever.
Yep, I think we can open up the questions now. Probably stop sharing the screens just so we can see everyone. So if you have a question and you want to either raise your hand or put in the meeting chat.
And I know that there were some questions that came in earlier. I will answer the ones that pertain to us and send those back to Melissa so she can share with the greater team as well. Yes, Vineet.
Thanks, Trudy. That was great. Yeah, no, I think the one number thing, it looks like really easy to use, and I haven't used it yet anyway, but I look forward to trying it with various patients. But I wonder, is there like any easy way to kind of see all the potential places that they can be referred to? Like kind of what are the menu of choices, just to kind of know, like some of the, I know that there's something out there, but I don't know what it is. I don't know how to get to it. I don't even know what's available. So I just curious if there's any that way.
I haven't thought of that, Vineet. That's a really good question. So I wonder if maybe so what we have done is for the Navigators Collaborative, what we've asked them to do is we have a membership list, and what we've asked them to do is just kind of give us a quick, this is the population we serve and this is what we do. So it's really quick, right? We didn't want to add another directory. So happy to share that a little bit, but I'd have to think on that one, Vineet. That's a really good question.
Yeah, I don't know if it needs to be something that's like part of your website or directory. Just more that as we're kind of promoting this service, just to have something to look at to see, oh, this would be good for these potential scenarios, and that's would be helpful for me, because again, the examples you gave were great, but sometimes I think maybe I have something that's smaller that would there still be something that I could get help with, or something else entirely that I haven't even thought about before. So.
Okay, yeah, let me think on that one. Hanadi and we'll connect and put our brains together. Thanks for that, Vineet. Go ahead, Jenna.
Yeah, I just want to comment on that as a response as well. I think with our navigators, our patient care assistants who are manning the telephone line, this is part of the soft launch, is really truly understanding who is calling and why are they calling. So we're looking at doing evaluations on what types of calls are we receiving, and then how can we better equip the navigators to be able to respond to those calls. So the soft launch, as Trudy has mentioned, has been very minimal in call volume, because it was just to see really truly that what types of calls are we getting. And we are finding calls that are coming to the navigation line are not typical calls that we would receive through home and community care support services, but more around your financial, your social, your housing, help with filling out forms, getting IDs replaced, some of those other scenarios that are outside of direct service, but more touching on how to get service from a wider lens than direct community supports.
So Hanadi just reminded me, Vineet, in the poster that we shared with that we've been sharing does have a little bit of information in terms of if you need help with this. So it's very short, but perhaps what I can do is ensure that Melissa gets copies of the posters both, and we have French and English posters available right now. By the end of this week, we're hoping to have Arabic, Spanish, and Nepali posters. So we can make those available to any one of you if you feel that would be helpful, to be able to share or put up in your waiting rooms, whatever works for you, because you can call on behalf of the patient, but the patient can also call on their own. Well, if any of you at any point have any questions, please don't ever hesitate to reach out to me. Melissa has my contact information. Happy to take any comments or feedback that you have if you try the number. Always willing to hear some good feedback so that we're always wanting to try to improve our services. So again, thank you so much for letting me present this evening.
Another call, any questions or comments on this presentation? Not sure, Jenna, if you had anything else you wanted to provide to the group about more the care coordinator side or home and community care.
No, just to give a little bit of historical sense here with the primary care direct phone line that we're relaunching with in alignment with the system navigation piece here with Middlesex London OHT. It's really around truly building that care coordinator connection back with our primary care partner. So we have done some work over the last over the summer months to realign our caseloads from a home and community care lens. To be attached to our chronic caseloads are all attached to primary care practices within the community. And so the work of relaunching the primary care line fits nicely within that primary care connection work and the navigation piece here with Middlesex London OHT, and truly is around having that live answer. So you will have that care coordinator attached to your practice, but as you know, your care coordinator's out doing visits or doing assessments, seeing patients, and so reporting patients in the community. So it's when you're looking for guidance, system navigation, or support from a clinical lens, and you need to speak with a care coordinator in the moment to help direct and provide some information. So that's when you would use the direct line to the care coordination team, and they're in office 7 days a week, 8 to 8. And then if the navigation phone line, as Trudy has mentioned, is for patients, providers, families, individuals in the communities who is just looking for supports from a wider lens of system navigation, healthcare navigation.
Jenna, did you want me to try present your slides or for you so that you can go through them?
I can present them if there's an appetite. I didn't want to take away from the focus of system navigation, and the presentation's really around the primary care connection. So I can, I'll share my screen here. Oh, it says I'm not able to share my screen. Oh, there we go. Thank you.
You should be able to now. I think
Yes.
I changed the setting.
Thank you for that. Okay. All right. Now I'm looking over here, so I apologize for that as well. Okay, so our primary care connections, this was brought forward to council back in June, just to highlight the work that we were doing around primary care connections. And I'm going to fly through a little bit of this, really focusing in on the system navigation piece here with the Middlesex London OHT. But as I mentioned, we have done work to realign our community caseloads to have primary care alignment, and really committing to successfully addressing patients' needs and support with care planning in the community. By re-engaging with our primary care partners, it's really working together to understand what the patient's needs and challenges are, and really provide that seamless quality care to patients. And it will be our expectation that the care coordinator is taking steps to build and foster strong primary care connections. So we know whether it was through the pandemic or whether just naturally, some of our connections have lessened in the community. And so we're looking to do some work to kind of get a good sense of where are we at with our primary care connections across the Southwest region, but then building those connections as well. So again, the focus is really on working together to improve care, reduce ED visits and hospitalizations, and really try and support the patients within the community by being better connected and collaborated together. What does define a strong connection? So we talk about having strong connections with our primary care partners, and it's really around establishing those connections. So we are asking our care coordinators who are attached to each of the practices, whether it's a family health team, a CHC, or an individual family practice or practice within the community, we're asking for minimum monthly touch bases with their primary care team. increasing on-site presence at the primary care for relationship building, and then just making sure that two-way communication is available with our primary care partners. Some activities that we're looking to build those connections is really introduce yourself. If you don't have that great connection, we're asking care coordinators to do that introduction meeting, establish those regular meetings at a time frame that works for the primary care. So it might not be directly with the physician, it might be with a nurse that works for your team, it might be with a navigator that works for your team. But it is building those regular connections so that there is ability to review who are the patients on the caseloads, who has come on, which services have been increased, which services have been discharged, or which patients have been discharged fully from home and community care services. Information sharing can include information like long-term care applications, who's been placed on the wait list, who's been removed on the wait list, help in system navigation and offer those navigation supports. Again, this is, as Trudy mentioned, did you know we have a direct line for primary care that is answered 8 a.m. to 8 p.m. The number is there as well. And again, this does go to a care coordinator for live answer to support with those connections if you're unable to reach your care coordinator in the community. Building on work that was done previously through the ministry and local health integration network days, we were pulling back on those levels of connections. We are asking our teams internally to report on where do they see and feel that their connections are in the community with their attachment to physicians or practices. And level 1 being no connection, which is fine. There may be other reasons for the no connection, where we're at, change in caseloads, teams, and then level 5 being a strong connection. And month over month, we're asking our teams to report on this so that we can see the activities that they're doing to promote that primary care connection. And then relaunching in September here. How are we engaging primary care? Just visiting those introductory meetings, setting up those regular touch points, providing the patient by physician list to primary care partners, and then promotion of the direct phone line for primary care. So I know I went through that relatively fast and apologize for that, but really truly this care coordination alignment with our primary care partners and relaunching and re-promoting that primary care line is truly to also help support the system navigation work that the Middlesex London OHT is doing, so that we have an avenue to support our patients and individuals in the community who may or may not be attached to healthcare services. And then we have a line to support those partners within the community for their navigation of healthcare supports.
Thanks, Jenna. Any questions for Jenna or questions in general? Just looking here at a couple of the comments or questions that came in with the registration. I don't know if Trudy and Jenna, you could comment on that. Some were asking about if this costs anything for the patient or the provider.
I think we're both waiting to make sure we don't talk over each other here. So there's no cost to using the navigation line. However, some services in the community there might be a cost with, and as we're referring or making those warm transfers or providing information on these services, that would be pieces of the information that we would provide to the patient. So if they were looking for transportation services and there was a cost associated with transportation, or meal services and there's a cost associated with it, that would be information that would be shared, or we would be connecting them with the organization who can share that information to the patient.
Great, thank you. And most of the other questions that came in, you already touched upon on in your presentation. Yeah, I don't want to keep everyone here if there's no questions, but like Trudy mentioned, if you have questions or whatever, please get in touch with LMPCA. I can direct them to Trudy and direct you to Trudy or anyone else as appropriate. And I see Hanadi has shared the one poster, the English poster in the chat with everyone. We'll make sure that's included when we send out all the details of this webinar, kind of the recording and the slides and everything. But yeah, final call for any questions. Oh, Trudy?
I just wanted to say we have the English one but if anybody wants a copy of the French language poster or any of the other languages, please let us know. We do want to make sure that we are capturing the communities that don't have or that are not speaking English or not comfortable speaking English at this point. So those are those were the top 3 languages that we were told for Middlesex London right now. So happy to share those with anyone and even drive them out. So don't mind doing road shows with Melissa if needs be.
Absolutely. Ready? Thank you everyone for joining us tonight, and have a great rest of your night. And like I said, watch for kind of some of the resources coming out, but thank you. And thank you, Trudy and Jenna, for presentation.
Thank you so much.
Have a good
Thank
night.
you.
Good
Take care.
night.
Bye.